the Honorable Attorney General, Faris Al-Rawi. Good morning to the Chief Medical Officer. A very good Wednesday morning to ladies and gentlemen of the media and to the listening and viewing public. Ladies and gentlemen, WHO defines public health as this. It is the art and science of preventing disease, prolonging life, and promoting health through the organized efforts of society. I want us to focus on the last 4 words of that definition, the organized efforts of society. Our society is made up of every single individual, organization, the government, arms of the state, the police, NGOs, places of religion. That is our society. COVID is asking us as a society to organize ourselves in a manner to do what the definition says, prevent disease and prolong life through the organized efforts of society. As we continue to face down the global COVID pandemic, it is going to take all of us, every single person, to play their part. We have tried the moral suasion on certain aspects, and many people are complying. We have done our health campaigns, our education, our prevention and treatment, and this weekend gone, we would have gone the way of legislation. It is clear from a photo on today's Newsday, the front page, that we are not organizing ourselves. This photograph on the front page of the Newsday filled me with nothing but sadness. And it is telling me, and every right-thinking person, that we are not organizing as a society, even though legislation has been passed. I took the time to count how many people are in this photograph. I got about 35. The excuse is being put out there that people don't have masks, can't afford masks. But in this photograph, for those who were facing the camera when this photograph was taken, I counted 4 persons with masks, but wearing them to support their chins. So clearly, we have the masks, but we refuse to accept, for whatever reason, that the mask is supposed to be worn to cover your nose, your mouth, and your chin. In this photograph of 35 persons outside a bank in Port of Spain, according to the caption, this is how COVID-19 is going to capsize everything we have done in Trinidad and Tobago. Because those 4 persons without the masks are going to take the disease home, infect everybody at home, infect the elderly, and we are going to get more deaths. So clearly, it is not an availability of mask issue, it is a compliance issue. Today, we are reaching or have reached a very sensitive part in this pandemic, where we need persons to please wear a mask, but as we intimated over the weekend, it is not only the wearing of a mask, it is stop congregating. So 35 persons in this photograph is clearly a breach of the public health ordinance, the regulations, clearly a breach. We are asking people to be responsible for themselves, for the lives of the elderly, and to please comply with the wearing of masks, the social distancing, I don't think we need to pass a law, EEG, to tell people to stand 6 feet apart. Although we could, but I heard it said in the parliament that that should be the next law. We should not have to pass a law to say if you are ill to stay home, to social distance, and all those things. So please, as we face down this virus, which is now, as we have seen, unforgiving, we need to have the organized effects of society. As someone who is charged with maintaining the public health of the population, COVID is going to pose a lot of challenges, both foreseen and unforeseen. This morning, I want to draw to the country's attention a foreseen problem that, if we don't address it now, could become serious. That is, because schools are now delivering content through a virtual platform and children are at home, one of the screens, one of the barriers that children had to cross to get into a school in Standard 1 was that they had to produce this to their school principal. It is called an immunization card, where it is recorded that your child has been immunized against childhood diseases, and when you open it, it talks about things like mumps, measles, rubella, yellow fever. I can foresee that because schools are on a virtual platform, that the examination of these physical cards, which shows proof of vaccination, could pose a problem if parents forget to vaccinate their children. I am paying attention to the numbers, and whilst there is no significant drop in the numbers, I want to urge parents to please keep up the vaccination schedules of your children so that we don't add another epidemic of measles onto COVID. Let us be proactive. Please keep up your vaccination schedules. The third public health foreseen outcome of this has to do with dengue. We are in the rainy season, and as the Chief Medical Officer has confirmed, the Aedes aegypti likes to breed in and around your homes, near to people, because they need that blood meal when they bite you, the female, to complete their reproductive cycle. It is important that people who own properties inspect their properties in and out for possible breeding sites. They can breed in a bottle cap cover like this. They can breed in your vases, in your gutterings, in your water tanks, in your buckets. We are trying to preserve our public health. We don't want to add dengue on top of measles, on top of COVID. So as the Minister of Health, charged with the responsibility of charting a course to good public health, I am urging Trinidad and Tobago to please let us organize ourselves according to the definition, to take all the public health measures, heed all the advice as it deals with congregation in the public, wearing of masks, getting your children immunized, don't slack off on your immunization schedule, and inspect your premises for any receptacle as small as a bottle cap cover, an empty beer bottle, soft drink bottle, anything, flower pot that contains clear water, to make sure that we don't have an epidemic of dengue on top of epidemic of measles, on top of epidemic of COVID. The government is doing all that it can in educating, in spraying, but as the Chief Medical Officer will tell you, you cannot spray an area too frequently because the mosquitoes will build up resistance to the chemicals and you create a bigger danger, because then you have mosquitoes that are immune to the chemicals. So this is the time for all Trinidadians, all Tobagonians, for us to organize ourselves, because according to WHO, it is the art and science of preventing disease and prolonging life and promoting health through the organized efforts of society. Let us organize. Thank you very much, Candice.
Thank you, Minister. Dr. Parasram will now deliver today's clinical update.
All right, good morning, honorable ministers, members of the media, members of the viewing and listening public. Today's clinical update, Wednesday, the 2nd of September 2020, is as follows. The number of samples submitted to the various sites in the public sector, 23,934. Number of unique tests submitted thus far, 21,012. Number of repeated samples, 2,922. Number of private sector tests, 5,880, giving us a total between the public sector and the private sector, 29,814. Number of samples which have tested positive are now 1,839. Of those, there are 1,120 active cases, and the number of deaths as of this morning has increased by 1, so there are 28 deaths so far, and condolences go out to the families of those who have lost loved ones during this fight against COVID-19. The number of persons discharged so far, 691. Over the last 4 o'clock yesterday afternoon to 8 o'clock this morning, 42 additional cases were recorded, including bringing those 42 persons will be brought in at the discretion of the CMOHs based on the new admission criteria and the clinical symptomatology, as well as the socioeconomic position that those individuals are in. Within the facilities, we have at the Couva Hospital and Multi-Training Facility, 72 persons. There are 6 persons in ICU at this time, 16 persons in the high dependency unit. At the Cora facility, there are 20 persons. All of them are low acuity clinically. In terms of our transition or step-down facilities, we have no one at the Brooklyn facility at this time, no one at Balandra. Tacarigua facility has 1 person. I'm told that that person should be discharged sometime later on today. At the UE Day side, there are 4 persons. UE Canada Hall, we have no one at this time. UE Freedom Hall, there are 39 suspected individuals. At the Napa site, there is 1 healthcare worker remaining. In our quarantine facilities, we have at the Paria Suites, 97 persons. At the Cascadia Hotel, there are 14 individuals. Regent Star, 42. Chancellor Hotel, 25. And at Home of Football, there are 25 individuals as well. Just to add to Minister's call for immunization, and I know one of the factors that have been plaguing persons not wanting to come in is really if they would be infected when you come into a healthcare facility. Just bear in mind that we have, from the beginning of this epidemic, created a parallel service so that those with viral-like symptoms go into a separate area, leaving the rest of the health facility free so that you can come in and have your immunization done in a very safe way. Of course, reminding you to continue wearing your mask when you come into the facility for the entire duration of your stay. Of course, your children will be immunized as quickly as we can, and we will get them back out. But it's a very important pillar of our system in public health that we have our immunizations reach to a threshold of about 95% of the population to give us herd immunity to protect the vulnerable ones. Thank you, Ms. Alcantara.
Thank you very much, CMO. And we now open the floor for the Honorable Faris Al-Rawi, Attorney General and Minister of Legal Affairs. We move to the Attorney General.
Good morning to Trinidad and Tobago. My colleague, the Minister of Health, is encouraged to listen to his coordinator because the Honorable Hostess was opening the floor to me. So, good way to start off with a little bit of light humor. Good morning, Trinidad and Tobago. Good morning to all. I have come this morning largely to answer questions and to state one simple bit of clarification that I think a lot of people have been reaching out for. There has arisen an issue as to the process by which our regulations came forward, and specifically the process involving children being subjected to the law. if you'd permit me a short moment to address with this. First of all, the process that has brought forward this law is an act of Parliament by which we amended the Public Health Ordinance so as to create an alternative system for treating with offences under the regulations. That alternative system is a fixed penalty notice system. Fixed penalty notices are common in Trinidad and Tobago. We have them in the Litter Act, the Dangerous Drugs Act, just to name two pieces of legislation which you may well be aware of. This legislation is what was debated in the House on Friday and in the Senate on Saturday. After that law was passed, we returned to the promulgation or making of regulations via the way that the Public Health Ordinance has always said it should be done. And this is now 105 years of regulations. And those regulations are quite simply that the Cabinet will sit and draft the regulations, settle the regulations upon the advice of the medical experts that give us information. We came therefore to the regular issuance of regulations, and specifically we came to the issue of mask wearing for children. Now, I'd like to refer you to the World Health Organization, because I heard it said in particular by members of the opposition that the regulations are lacking in clarity. And I'd like to tell you, first of all, you need to have regard to what the World Health Organization says. As it relates to children, the World Health Organization specifically says that children should be regulated by the laws of different countries. What the World Health Organization prescribes as a general rule, subject to each country's purposes, is that children under the age of 5 should not be compelled to wear masks. They say definitely treat with children in the bracket above 12 exactly as if they were adults. And they say in the age group 6 to 12, you need to apply a risk-based approach. And that risk-based approach is where there is widespread or community spread transmission, the ability of a child to safely and appropriately use a mask, the potential impact of mask wearing on the learning or psychological development in consultation with teachers. We then very carefully entered into an analysis of a number of countries, and I'd like to tell you the countries that we went into. We went into the following countries: Australia, Canada, Ireland, Malaysia, New Zealand. We then went to Singapore. We went to the United Kingdom. We also went in the Caribbean to Antigua and Barbuda, Barbados, Belize, Dominica, Grenada, Guyana, Jamaica, St. Kitts and Nevis, St. Lucia, St. Vincent and the Grenadines. We also went to Anguilla, Bermuda, British Virgin Islands, Cayman Islands, Montserrat, Turks and Caicos Islands. And in all of these jurisdictions, children are treated with. And in some of these jurisdictions, there is no exception for children of any age at all. In some of the other jurisdictions, they start with an age limit. For instance, you look in Canada, of 2 years old. And in other jurisdictions, 11, 12, or 13 years of age. And therefore, what the legal research demonstrates right here in the Caribbean, in the Commonwealth as well, in the wider world, is that children from the WHO standard directly down to the individual laws of all of these territories and countries that I've called out, they all prescribe for wearing of masks by children. Now, I heard it said that there was some degree of confusion as to what happens when a child is approached with a fixed penalty notice situation. Let me break it down very simply. Regulations 6 and 7 provide for a fixed penalty notice, firstly with respect to children who are in a public place, and secondly with respect to children who are in a vehicle or vessel. A vessel is a boat or anything on the water. We have specifically said that children under the age of 8 years of age in Trinidad and Tobago are not subjected by law to the wearing of masks. Stick a pin. We have asked parents if your child is capable of tolerating a mask safely and there is no issue to wearing the mask, please have your child wear a mask. In Canada, the law is 2 years and above that you must wear a mask. In most of the Caribbean, some of the territories, there is no age limit, meaning from an infant up. Now, the position in relation to our regulations has been very clearly set out. Number one, if the child is in the company of an adult, that adult is a person with responsibility for the child. Anybody who has care and control, actual looking after the child at that moment in time, has care and responsibility for the child. That person is subjected to a $1,000 fine in the event that that person does not ensure that the child is wearing the mask. Secondly, if a child is in a public place, a vehicle or a car, and not the sole occupant, we provide for the situation of a child being exposed to the law. Now, some people question this. They wondered, why would a child be exposed to the law? Some people even thought it was unfair. Allow me please to clarify this. It's really extremely simple. The only way that you can bring the child to the attention of public health and for the police to deal with this, after the police have no doubt inquired if there's a reasonable excuse as to why you don't have a mask on, because the law says for adults and children, you must have a reasonable excuse for not wearing the mask. Once the police inquire as to what is the excuse, there is no adult present. Yes, the law provides that someone who is 8 years and above may be subjected to the issuance of a fixed penalty notice. I want to remind, however, that the Children's Act works in conjunction with this law. Chapter 4601, this is the Children's Act number 12 of 2012, specifically provides in sections 56 and sections 57 what happens when a child is brought to the children's court. In our country, anybody under the age of 18 years must go to the children's court, not to a regular court. Secondly, the form of notice that we have clearly sets out that the parent or guardian's information may be captured, but in any event, sections 56 and 57 of the Children's Act specifically provide that where a child is charged with any offense, which is treatable by a fine or damages or costs, that the parent, guardian, or person with responsibility is the person who the court will look to for the payment of the fine. I refer you specifically to section 56(1)(a) and (b), and it is the parent or person with responsibility for the child who specifically has responsibility for the payments of fines. This is so even where a court still goes down now to section 57 of the Children's Act, where a child is convicted of an offense and the court is of the view that the parent, guardian, or person with responsibility for the child has failed to exercise reasonable care of or supervision over the child to ensure that the child does not commit an offense, the court may call upon the parent, guardian, or person with responsibility to show cause why he should not be required to pay a fine. So, ladies and gentlemen, our laws are extremely clear. They are no different from the Truancy Act, from truancy under the Education Act, where a child is brought before the court. It's no different from any other offense which a child can commit. Litter, dangerous drugs in certain circumstances. So it seems that this was in need of a bit of clarification. Number one, the WHO says you ought not to require mask wearing for children under the age of 5. They say in the period 6 to 11, have a look at the situation of the risk in your community. In the umpteen jurisdictions that we looked at throughout the Commonwealth and the 16 jurisdictions right here in the Caribbean context, all of them provide in various degrees for the treatment of mask wearing and for penalties for not wearing masks for children. In Canada, it's 2 years of age. In parts of the Caribbean, Jamaica, etc., there's no age limit. So our situation is that COVID is no respecter of age, circumstance, class, color, religion. COVID is something which is capable of being spread by children as well. One must therefore regulate the situation as it pertains to children. We have not sought to go outside of what our law knows, and that is that the Children's Act says if a child is brought before the court or a child is given a fixed penalty notice, the child must attend with the parent, guardian, or person with responsibility. That's the law. The parent goes, the person with responsibility goes. Secondly, the person with responsibility is the person who the court will look to in these circumstances for the payment of the fine. So we are not doing anything that is not well known to our law. Very importantly, please remember, in Trinidad and Tobago, we have a children's court. We have a separate jurisdiction called the Family and Children's Division. We have a children's court. There's one at Faizabad, which services the southern region. There's one in Port of Spain at St. Clair, which services the northern region. And there is one in Tobago as well, which services Tobago. All of the notices specifically set out that the parent or guardian or person with responsibility must attend with the child. This attendance on the form itself is by way of a virtual hearing. It is not intended that we are going outside of the WHO parameters or the many examples in law in the many territories that I've referred to a short while ago. I'm confident that honorable citizens will understand this position. There's only been some degree of clarification requested. We did not go below the age of 8 because in our law, under the age of 8, you are incapable of committing an offense at law. This does not mean that parents should expose their children to risk or danger. We encourage parents to ensure that their children, if they can tolerate it, can wear a mask. Lastly, I'd like to say, I noticed that several members of the opposition, in particular one senator, alleged that the law was unclear and that there were no interpretation formulas given for medical emergencies or for what is severe distress. I would just urge the opposition to please have a reference to the law. You will note that every country around the world, all of those that I have just referred to, are in the same situation, by and large, as Trinidad and Tobago is. This is not a time for cheap politics or poor research. Most respectfully, it's about ensuring compliance. I'm confident that you would have some questions during the course of this interview, and therefore I thank you for this opportunity to clarify.
Thank you, Attorney General. Our question and answer segment is up next. I ask media representatives, please begin by stating your name and the media house that you represent, and please pose no more than 2 brief questions. If we have more time, we will take an additional question from journalists. We begin with questions from Guardian Media Limited. I think we're just waiting to hear from Guardian Media Limited. That's Rashad Khan.
Hey, good morning, everyone. Rashad Khan, Guardian Media Limited. Okay, so my first question is to the Attorney General. I know you said there was going to be a 2-day grace period, but can you state if anyone has been fined as yet for not wearing their mask or any of these new regulations added in? And my second question is to both the Minister of Health and Chief Medical Officer. We're hearing that asymptomatic patients asymptomatic persons who are primary contacts of patients are no longer being swabbed. And now that raises concerns because many persons, especially within the Victoria district, say they aren't being allowed to, or they aren't getting through to access state quarantine facilities. And also it raises questions about how many deaths that we saw recently occurred at home.
So in answer to your first question, thank you, Rashad. As far as I'm aware, no one has been charged. Specifically, the Trinidad and Tobago Police Service are out and about. I spoke with the Commissioner of Police, and they are actively encouraging people to wear the law, to obey the law and wear the mask. Yeah, I guess it's fair to say to wear the law. Your mask is in fact the law. So there is an intention to urge people into compliance. There will come the day, as soon as these tickets are distributed today and tomorrow to each one of the police officers in the stations with responsibility, there's going to be some heating up of the position. If you really look to Trinidad and Tobago, as the Honourable Minister of Health started this morning, we really need to be our brother's keeper, our sister's keeper, and encourage. And Trinidad and Tobago, we're good at calling out people. Call out people for not complying with the law. This is not a time for smart manism or smart womanism. It's not a time to be as novel as you can be in every exception as to why the law ought not to apply to you. We do not have the liberty of protecting our society without cooperation. So let's call out our Trinidadians and Tobagonians and even our residents and visitors. Please comply with the mask wearing requirements.
Thank you, Attorney General. And we move to CMO, who will answer the second question, please.
So in terms of our policy, we related to swabbing. We swab anyone that is a primary contact generally. However, there are certain groups that we did a slight amendment. Those are within a household, that persons who have developed symptoms post-dating the original person that is positive, seeing that we went to home isolation. Those persons that are predating the person that is positive in terms of symptomatology, we are swabbing them right away. The asymptomatic cases we will swab thereafter if need be, but they will be monitored for the full duration of 21 days. Primary contacts outside of a household, whether you're symptomatic or not, we will continue to swab those as per usual. Regarding your deaths at home, I believe the figure, I had at least one person that I could recall. I'll reach out to Dr. Trotman to get a figure if there's anybody else that had died at home. And that again predated, I believe, the stay at home while you for isolation, that process. And it really underscores what we are trying to do by our monitoring and evaluation from the CMOH offices. So we are calling persons twice a day, as you know. In addition to which, we are trying to get as many pulse oximeters, which is an objective clinical tool that we are using to measure your oxygen saturation as well as your pulse. That can be done as many times of the day as you, as a person, as a clinician, as a patient, wants to do. It takes a few seconds to have that done. And the guidance given from the CMOHs is if your pulse oximetry level, your oxygen saturation, goes to less than 94%, then of course you red flag that to either the CMOH that is in contact with you, of course, or if you can't get onto that individual, we go straight to a health facility or an emergency department that is nearest to you. But just to underscore, this disease has something with it. COVID-19 has something with it. And the persons that are at home at now, there is something called silent hypoxia. Basically, silent hypoxia means that your oxygen saturation level drops below what we see as normal. Normal oxygen saturation in a normal individual without disease should be on room air above 96% when you check with a pulse oximeter. And that's why we have a high index. Some countries are using 90% to contact your healthcare provider. We are using 94% because we don't want to get it to the stage of 90 before you actually seek medical attention. So it underscores if you have increased shortness of breath, if you are vomiting, if you have severe lethargy, we don't wait for things to get worse. We go in to a facility that is nearest to you, contact your healthcare provider, utilize the ambulance transfer line 811, or utilize our numbers 877-WELL, 800-WELL. Thank you, Candice.
Thank you very much, CMO. And now, Express newspaper, please pose your questions.
Hi.
Sorry, we're not hearing Express.
Hi, good morning.
Okay, great.
This is Leah Suraj from the my first question is for AG Al-Rawi. AG, as you would know, there has been some outcry from some members of the public over the part of the mask wearing law requiring families coming from the same household having to wear their masks in their private vehicles. Is consideration being given to reviewing this part of the law? I'm seeing some people being creative by sticking not PH taxi signs on the windscreens. Can this be allowed?
I'm sure. Thank you for that question. I'll repeat the the phrase that I've just said a little while ago, smart manism and smart womanism. Come on, guys. We all know ourselves. This is Trinidad and Tobago. We have a thriving PH industry, which is extremely difficult to manage. We're in tough economic times where some people are earning a living by PH management. We have one alternative. Go to the position of saying, well, if you're a member of a household, you don't need to wear a mask. And then immediately call out all the roadblock facilities in Trinidad and Tobago, sit in long lines of traffic in a grinding heat situation, and have the police ask everybody to demonstrate that they are members of the same household. Worse yet, in Trinidad and Tobago, where many of us don't have the same surnames and are members of the same household, folks, let's just be practical for a moment. You're outside your house. You're bothered to get into your car because you have the privilege of wearing a mask in public, and now you're in your own car. Put on your mask. It's the same as the person who is compelled to use public transportation, who has to get on a bus from San Fernando to come to Port of Spain to go to work. That person wears a mask in a public vehicle. It might be a passenger car. The driver might be living in the same yard. We have to just simply exercise common sense and reasonableness. Let's allow the country to get back to work by just wearing your mask. So no, we're not looking at revising this position. And yes, we've been inundated by umpteen requests where everybody says it's by far simpler just to do it with members of the same household, because once they are good, it doesn't matter how the police operationalize the law. Respectfully, there's a little bit of a larger balance that we have to have in effect, and the police themselves have accepted that this is by far a better use of police time to do it this way.
Thank you, Attorney General. And now, TTT, please pose your question.
Question for... Hi, thanks, AG. My second question is for Minister Dialsing or CMO. PAHO director has raised some concerns about Trinidad and Tobago's COVID-19 testing. He's saying basically that compared to other countries of similar population, COVID-19 testing in TNT is low. How do you respond to this, and do you agree that we should be ramping up testing? Thank you.
CMO.
Thank you very much, Express. And I believe CMO will take this question, please, after CMO.
Right. So it is not, and from the beginning, we have been testing based on a clinical case definition. We have been testing symptomatic people from day one. We test people that come to our facilities. We don't go to someone's home unless you are primary contact or a case at home to do testing in your family. So we have abided by the PAHO WHO guidance and mainly the WHO alignment with their clinical case definition for testing from day one. So we have not, in terms of ramping up testing, as you have seen, there has been a considerable increase in testing over the last month. And that has been so because we have seen a lot more viral illness presenting to our facilities. So as it goes, in the first phase, we had very little to none to nil viral persons presenting at certain facilities. I would have walked around at the different facilities during phase one and actually saw for myself, we hardly had any persons at all presenting with viral illness. We can only test what presents to us. So we stand ready to test the viral illnesses that are coming into our facilities. And I think we have proportionally tested quite a large number of those who presented. Again, it is a voluntary process for persons to refuse testing, which has happened in the past. We will continue to increase our testing based on what we are seeing in terms of our viral illness presenting to us. We don't check to see if we are testing 10% of our population or 20% of our population. This is not new to COVID-19. This is testing across the board for any viral illness. For H1N1, for dengue, for anything that presents itself, we present and test based on a clinical case definition, and that will remain the same. We are not trying to meet some goalpost in terms of number that has been put out there. We are testing as much viral illnesses that present our facilities to know what is happening in our country. Candice?
Thank you for the clarification, CMO. And now to TTT.
Hi, good morning. Sunil Lala, TTT Limited. CMO, I know you spoke about the immunization and you want parents to get their, I think it was the health minister, parents
Yes.
to get their children immunized. There are still parents who are still basically afraid to carry their children to the public health centers. What can you assure them is being put in place at the various health centers? I know you said the persons are being routed if they have symptoms and not. The parents are genuinely concerned about that. Is there anywhere else they can go? So on. And secondly, is district nurses used to visit homes. Is this still being done to help people there, ensure their children keep up with immunization as well?
So, Sunil, I will take possibly the first part of the question, and then the CMO will give you his expertise on the matter. Since the start of this COVID response, we had set up different pathways at the health centers for people with acute viral illnesses. You follow that pathway. Other people with non-acute viral illness had a different pathway. So the separate pathway for immunization has always been there. My reason for raising the issue of immunization this morning is that in Trinidad and Tobago, I believe it is the law under the Education Act or some Public Health Act, the CMO can tell you, to gain access to a public school and a private school in Standard 1, you had to present your immunization card as proof that your child has been immunized against all the childhood diseases: measles, mumps, rubella, yellow fever, tetanus, and so on and so on. The point I'm trying to make, now that school has reopened using a virtual platform, this last hurdle, this last screening is now no longer applicable. So what we are trying to do at the ministry, we are trying to prevent an outbreak of measles, mumps, rubella, yellow fever, and so on, by asking parents to continue their immunization schedule even though it is not going to be requested to physically attend school. And that is the purpose for me as Minister of Health raising it here this morning. So you can access your childhood vaccinations at health centers or your private doctors if you feel that is safer. And CMO could probably take it up from there.
Yeah, thank you, Minister. I think Minister answered the majority of it. I mean, as I discussed in my clinical opening, there is an alternate pathway. And of course, your mask, once you wear your mask while you're in the facility, of course, your children may not be able to if they're less than 5, but for those above 5, they can wear their mask even during immunization as well. Regarding DHVs, the district health visitors, their role and function is actually to visit homes in certain instances and do vaccination, which continues. There are drives from time to time, as you would have seen for influenza last year, where we go out to public spaces, to markets, to maxi-taxi hubs, those kinds of places to do immunization. So the outreach programs are continuing, and we will continue to increase those as we go into the influenza season.
Thank you very much, CMO. And now we get questions from CL Communications, please. CL Communications.
Good morning, Vivian Bowen here.
Morning.
First question, pertaining to what the Prime Minister said that COVID-19 created a $15 billion hole for the economy. If and when will we get a comprehensive breakdown of monies spent on the COVID-19 pandemic? For example, money spent on PPE, money spent on step-down facilities, money spent on meals and medication, etc. Second question for the Attorney General, just for clarification, because a listener actually called and asked, if 2 children under 8 are in a vehicle with 1 parent, does the parent still have to wear their mask, or will the parents could parent be charged?
Okay.
Thank you.
Thank you. So I will attempt to answer the first part of the question. For the first phase of the COVID response, Cabinet, I would have gone to Cabinet with a note asking for $157 million for the response in Trinidad, the TRHA would have gotten separate cover for an additional $50 million. So that's a total of about $207 million. The last figure I have for the Trinidad response, which is a bit dated now because we have to update it, was around somewhere between $50 to $60 million expended so far across the entire COVID response. So that is the information I have for you at hand. Thank you very much.
To answer the question put to the caller that called in for you, it's quite simple. The word alone means alone. If you're alone in the car, meaning there's no one else, you don't wear a mask. If there are children in the car, you're not alone. It's really just a simple matter of understanding. I understand where the question comes from, however, because surely it's driven by the fact that the kids under 8 are not required to wear the mask. But really, remember, if your child is capable of tolerating a mask to 7-year-olds, and you think that the child can tolerate a mask, it's an opportunity to have the child wear the mask. Let me put this into a different dynamic outside of COVID. We often complain as a country that our society is off its rails. We say that there isn't a sense of discipline in our society. We complain that the youth is lost. Whilst we take our home seriously and we want our country to grow, this COVID compliance with a simple rule of wearing a mask is a great way for us to cause a shift in society. If parents take responsibility for their children, encourage their children to wear masks, this simple exercise of urging compliance from the young go straight up to the old has the effect of bettering our society. So let's take a little challenge today and look outside of COVID's protection of lives and livelihoods, because we want to get back to work. And let's look at it as a good opportunity to simply instill some discipline in our country. Encourage your kids to wear masks. Encourage your fellow citizens to wear their masks. Quite simple.
Thank you, Attorney General. And AZP News, I believe you have some questions.
Hi, good morning, Priya Bihari, ACP News. Mr. AG, I just wanted to find out, if you can elaborate a little more on why it is that you put the penalty, the sanction on the child rather than putting it on the adult or the child's parent. One, and the second question for the Minister of Health, just to clarify in terms of the vaccine, is it one specific ailment that people are coming forward for, or is it across the board that you find that people are not coming forward to vaccinate their children or all the ailments?
So thank you for pressing the issue prior. It's across the board. We are just appealing to parents, go and get all the childhood vaccinations that your child needs to have. Mumps, rubella, measles, yellow fever, whatever they are supposed to have, keep on it. Thank you.
To answer your question, Priya, hello to you, good to see you again. It's quite simple. The way that you cause a child to bring the parent into tow is to give the child the fixed penalty offense. If the parent is in the company of the child, the person with responsibility, the guardian is in the company of the child, that person will get the ticket on the spot. If the child is alone and the child is not complying, the police has made inquiries, it's open to the policeman or policewoman to visit a fixed penalty notice. The Children's Act now compels the parent or person with responsibility to come to the virtual court with the child, and under sections 56 and 57 of the Children's Act, the parent is the person who is exposed in the largest way to the treatment of the fine, etc. Why did we go directly to the child? In all of our laws in Trinidad and Tobago, in the largest context of it, that's the way you go. Whether it's under the Education Act, the Dangerous Drugs Act, the Litter Act, even driving a motor vehicle, because we have 17-year-olds who drive motor vehicles and they're not children in some countries, but in Trinidad and Tobago they're under 18 years of age. Even then we treat with children directly. The greatest example is probably truancy under the Education Act, where the parents are involved in the situation. But our basic law and all of the laws that we have looked to, bar a few examples, treat with the child as It's in the same way that we have in Trinidad and Tobago. If you were to do otherwise, you'd be on the spot with the policeman going to look for a parent at that moment in time. And it's really quite simple. If we did it in the reliance on our existing laws, treat with the child. If the child is in the company of an adult, treat with the adult. If the child is not in the company of an adult and the child is not complying, has no reasonable excuse, the fixed penalty ticket goes to the child, and after that, the parents become involved. Section 56 and 57 of the Children's Act, that's who you're looking at. They attend at the children's court with the child, and the law allows for the parent to be exposed to the fine.
Thank you. And now to Loop TT, please. Loop TT. So I'm wondering if we're Loop TT, are you ready with your questions? Okay, I think we'll give Loop TT a little time, and we will go to questions from TV6 and return to Loop TT. So TV6, please pose your questions.
Hello, good morning. Good morning, everyone.
TT, thank you. Good morning. Please pose your questions. We're hearing you.
Good morning, everyone. Elizabeth Williams, TV6 News. Good morning to the panel. My questions include, I know that Grenada has placed Trinidad and Tobago on its high-risk red travel zone in light of increased COVID-19 cases. This question is to the Minister of Health. Is this of concern to the government? And my second question, there continues to be delays in test results. And at this time, specifically for Tobago, many are still without their salary relief grants. Documents have been sent to Trinidad because we have been informed that the Ministry of Social Development, this ministry is in charge of sending back the documents to Tobago. However, I called the Ministry of Social Development to find out what the delay was, and an employee said person should reapply so that the process is faster. I don't know if an investigation can be launched into the delay in initial COVID-19 grants being delivered to the people of Tobago. Thank you.
Thank you very much, Elizabeth. I will take your first question to deal with Grenada. Let us not treat with Grenada in isolation. Let us treat with what all countries around the world have done to protect their indigenous or home populations. January 30th, 2020, Trinidad and Tobago took the unprecedented decision that anybody leaving China had to spend 14 days outside of China before entry. Then we banned travel from England. I don't want to go through the whole thing. The point I'm trying to make is that every country has a responsibility to protect its home population. And what Grenada has done is in line with what we have done and every other country that has to act to protect its home population. So we can have absolutely no quarrel with Grenada, Barbados, in the same way that we would have acted very vigorously in the first stages of the pandemic as England is acting, as Germany is acting. So we can have absolutely no difficulty with Grenada or Barbados. Hope that answers your question.
Thank you. And we had a second question, test results.
CMO.
We move to CMO for that response, please.
Candice, I don't, in terms of delay for test results, in particular from Tobago, I know they have a gene expert machine which turns around the test within 45 minutes. They do most of their reporting. Some of the community tests have been coming to Trinidad that they can't accommodate, and I will look into those particular tests and get back to you if that is possible.
Thank you, CMO. And we move now to I-95.5. 2 brief questions, please.
Good morning to everyone. Whitfield to I-95.5. CMO, I believe my first question for sure would be for you. With respect to the numbers that we've been getting in the past weeks, how has the returning nationals been contributing to that? Is it small numbers? Is it moderate numbers? How does that stack up there? And just to follow up on Liz's question last week, Dr. Nandram would have spoken about increasing the testing capacity in Tobago. Are we now in a position to see exactly when this increased capacity would be ready for use? Thank you.
Thank you. And we're moving to CMO. I think CMO will address the questions. Chief Medical Officer.
Yeah, so in terms of the numbers of returning nationals, they have been, as you would have noted, the number of returning nationals would have been about 100, 150 over the last couple of weeks. A small proportion, if just a few of those would have been positive, so it doesn't contribute largely to the numbers that you're seeing in our national update. The numbers are predominantly coming from within our population that is living in Trinidad. As it relates to Tobago, again, they do have capacity to test all their severe cases, urgent primary cases. Some of their testing will be supported by Trinidad as well, as has happened in the past. I will get, as I said before, I will get some figures as to how much testing is outstanding from Tobago and then get back to the media.
Thank you, CMO.
May I just add some clarity to two issues? On testing for Tobago, we have ordered 10 more gene expert machines with increased number of panels, meaning the lowest panel number for some machines is 1, some are 4, so we have ordered 10 more gene expert machines. We will be sending some of these higher, 1 or 2 of these higher capacity gene expert machines to Tobago, so that is what Dr. Nandram was speaking about. On the issue of the salary relief grants, the Minister of Finance is looking at the issue, and I'm sure we'll have a response.
Okay, thank you, Minister. Loop TT.
Hi, can you hear me?
Yes, good morning. Please pose your question.
Hello, good morning.
Good morning.
Good morning.
We're hearing you, so just ask your questions and we'll respond.
I'm barely hearing anything at all, so I'll just ask. I think TTT is having some audio issues. I'm just trying to get some updates on the testing backlog that we've been facing. I know lots of measures have been implemented, but somehow I'm still hearing of cases where people who were tested almost a month ago still have yet to get their results. Some of these people are actually symptomatic, and they've gone through that quarantine period, so now they're kind of at a loss on how to function. So I'm asking, how close are we to completely rectifying the backlog, and what advice we can give to people, both symptomatic and otherwise, on how to go forward?
Okay, thank you, Loop to TT, sorry, and we go to CMO to respond, please, Chief Medical Officer.
Yeah, so as I said on Saturday, there is a surplus in terms of the way the tests are coming in. So we're actually doing more tests than are actually able to be done in any particular day. So there's almost a rolling backlog at this point. We are working to get 3 additional machines fully functional by getting more kits in, hopefully sometime next week, which will help greatly in terms of our capacity throughout the country. And then we'll be able to pick up on that backlog. In terms of persons who have not received their results as yet, the county medical officers of health have been working together with the chiefs of staff to get those results pushed out to everyone through various formats, and we'll continue to try to get that process streamlined so that the results go out more quickly. If you were placed on a quarantine order as a primary or secondary contact, you have no symptoms throughout the period, and you have not received your result. Once you remain asymptomatic, your 14-day quarantine period ends, then you are free to go back out to work. In terms of symptomatology, once you have any sort of symptoms, whether it is of COVID-19 or any viral illness, we ask that you stay at home and contact your healthcare provider, either the CMOH or use the 877 well number to get some clarity on those particular instances.
Thank you, Chief Medical Officer. And now Tobago Channel 5. I think you have questions. Tobago Channel 5. Nice.
Hi, good morning. Candace Jackson, Tobago Channel 5. My 2 quick questions are public health officials still going around monitoring businesses and so on? Because what we're realizing is that things are either not being maintained in terms of cleanliness, and then the soap and so on has been provided for customers are very much watered down. So of course that would defeat the whole purpose of trying to sanitize before you enter the business places, as well as what would trigger the end of the mask law. What can this is look forward to in terms of, you know, when can things get back to some level of normalcy at least? Those are my two questions.
Thank you. So I will try to answer both. The answer to your first question is yes. But again, everyone has a responsibility. The same way the AG said you don't want to take up police time and having a roadblock. We are asking everyone to voluntarily comply. Our public health officers are out, but of course they can't visit every single establishment every single day. Second part of your question, what will trigger us not having to wear masks? Only when the world conquers coronavirus. Only then. We have to learn to live with this virus for the foreseeable future. We now have 26 million cases around the world. Case numbers continue to be between 250 and 300,000 cases per day. So there is no horizon in sight to say that. But if people continue to behave like how we saw this photograph in the Express, we are only delaying some return to normalcy. It is going to take all of us working together as a team, as a country. As the Prime Minister said, let us love each other. We could love each other now by simply wearing a mask. Thank you very much, Candice.
Thank you, Minister. And in our last few minutes, we will take questions from Newsday now, please.
Morning, Clinton. Good day.
Morning.
My question firstly to the Minister Dial saying, could you give us an update as to whether the antigen kits expected to arrive? And in the same breath, could you comment as to a question posed by infectious disease trust Dr. Rajiv Fernando, who suggests the method of antigen test is somewhat flawed in terms of the COVID response?
Okay.
And secondly, to the Attorney General, given what has been said today regarding mask legislation and children and so on, how can someone, either an adult or a child, be able to prove to a police officer that they are unable to wear a mask for physical or mental reasons? Could you address those issues, please?
Okay, so I'll take the first part, then the CMO will take the technical part of your question about the use of the test, and then we'll go to the Attorney General. So, PAHO would have approached me in the middle of August because I'm seeing some opposition politicians taking ownership of this initiative. It's so sad. At least that person realizes it's not the sunshine. So PAHO would have contacted me in the middle of August, given us a 2-week deadline to sign on to the antigen testing. We accepted the offer in the middle of August, which is about a little over 2 weeks ago. We then sat with the CMO and other officials and worked out our needs analysis. We came up with 160,000 tests. We have already decided where the tests will be deployed. We have decided the protocols. The tests have now gone in with PAHO's request from other countries into our production line, because manufacturers don't just produce tests to leave on a shelf. You have to have a firm order. It goes into our production line. So I would have signed off on the letter on Friday, the 28th of August. We are now in that production line. It has to be produced. It has to be tested. You have to test samples. It has to be shipped to our agent and then air freighted down to Trinidad and Tobago. So there are some variables outside of my direct control, and we are hoping to have it here in the shortest possible space of time.
So basically what it is a antigen rapid test. We have spoken before about rapid tests being serological tests, which actually test for an antibody. So the difference between the two, an antibody test is not testing for active disease. It tests for disease 10 days to a month after you develop symptoms or after you are infected and presenting symptoms. So an antigen test is best used 0 days of symptoms to 10 days of symptoms. So this particular test from the manufacturing site has said it will give us anywhere between 80 and 90% certainty that we are dealing with COVID-19 if we are using it on persons that present with signs and symptoms. It is not to be used on persons that have no symptoms, because after that you will have a drop in its sensitivity and specificity. It will give you a large degree of false negatives and false positives. So the group of people we are using it at predominantly will be anyone that presents with symptoms resembling COVID-19. It is like akin to a pregnancy type test. You will still have to take a nasopharyngeal swab. We place that viral material onto the kit, and then within 15 minutes you can actually get a result which is 80 to 90% accurate, saying whether you have COVID-19 or not. So those will be placed at any center where we see viral illness, predominantly in the primary care setting as well as the emergency departments, to tell us quickly if someone has COVID-19 or not. So that's the method of use that will be taking place once we get those kits. I think it will be something that will greatly enhance our ability to test quickly, to make the diagnosis, and then of course to put persons away from our suspect areas into our COVID-19 hospital and get them treated as quickly as we can, to differentiate those categories that sit on the gray area, something we call SARI, which is severe acute respiratory illness, which can be many causes of illnesses, including COVID-19, bacterial and other potential causes. So it will sift out that group of patients very quickly so we can get those patients where they need to be and treated appropriately.
Thank you very much, CMO. Now to Attorney General.
Thank you very much, Clint. Thank you for the question. How do you prove the reasonable excuse? You have to prove it to the policeman in the first instance, not prove but satisfy, because the policeman must have reasonable cause. The Commissioner of Police has already, through his people speaking on the issue, indicated that whilst people are getting accustomed to this law, if you have your medicals on you, please be encouraged to demonstrate that position by way of the proof that you have. Otherwise, it's a matter of satisfying the policeman and ultimately a court, if you really want to press the issue, that you fall into the exceptional circumstances. I was eating, I was drinking, I was in the car alone, I have a underlying medical condition which caused me to be in this situation. So there are a number of factors. Remember, a lot of people that have underlying medical conditions are themselves at risk of COVID in general. So I think that there would be a need for double caution on that person's point. Does any country around the world specify how to satisfy this issue? No, they don't. In the Commonwealth, there is that clause, reasonable excuse. There is that clause of underlying medical, physical, mental condition or extreme or severe distress. They are not defined. They are intended to be the plain and ordinary meaning of those things. But in some jurisdictions, and you're going to smile when I say this, they have great laws and then they have long bamboo sticks and some very robust ways of enforcing the law that we will certainly not be applying in Trinidad and Tobago, as much as some people encourage it to be done. So you can see that there really is a whole shift around how this is done. Again, avoid the smart manism and smart womanism. Just wear your mask. Encourage people around you politely to put on their masks, and let's get on with getting back to work and getting back to livelihood.
Thank you very much for joining us at today's media conference. And remember, please follow the new normal. Everyone have a safe and wonderful day.